Hello, dear colleagues. How are you? My name is Berdikhojayev, and my assistant is Davlet Suymbetov. Operating nurses Bakht and Nazım. Anesthesiology team, anesthesiology nurse is Saltanat, and video support today presented by Evgeny Grishayev, Videon company. The patient number 2, in the early morning we had a patient with meningioma, but the first meningioma was parasagittal in anterior fossa, and the supply was from the ophthalmic artery, and we recommended to the patient to go to gamma knife because of the ophthalmic artery supply and some risk of the ophthalmic artery problems if the operation will be through the ophthalmic artery. That's why the second patient was with the ACA aneurysm, and now we have a patient with the meningioma. Patient under local anesthesia. We are communicating with patient, and Davlet took a Fubuki, and now I will ask Bakht to give me the DMSO, and then we will take 2% 4 cc lidocaine. It's local anesthesia, intraarterial lidocaine. 4 ml. We call this lidocaine technique Adnan technique. We learned from Adnan Siddiqui. Maybe somebody is also doing lidocaine. Nowadays it's a quite popular technique when the migraine treatment with the lidocaine, and now we are using it for the all meningeal artery interventions. Что там, брат? Хорошо. Okay, let's put it in the saline. Okay. We asked Bakht to give a Sonic 1.535. Unfortunately, we have no on the shelf headway duo 156, which is very nice for the tortuous meningeal anatomy in combination with Traxes. In my practice, in our practice, it's the best combination. I hope the colleagues also start to do this meningioma with the headway duo. Yes, the sonic navigation is a little bit, it could be a little bit problematic because of the tortuosity. It might detach. The hybrid is damaging very quickly. Okay, let's see what we can do. Was проекция трогает, да, Давлет? Okay, let's use this projection. And today we have a colleague, guest colleague from St. Petersburg. I think something is changed. This is not the same projection. Yes, we have a colleague from St. Petersburg, Lyubov, in the operating room, and now we are waiting for the second colleague from Mongolia, from Ulaanbaatar. He already arrived in Almaty airport, And now, okay, now we're waiting for him also. Okay, let's look like something. Yes, as much as possible we place the Fubuki 7 French angled distillery. Okay. Stop. Назад. После. Stop. Okay. Where are the Meningioma? The Meningioma is come a little bit early. Yes, it looks like Meningioma. Чуть-чуть ларноксикам бересосный. Ларноксикам. Yes, we will ask for the oxycam, meloxicam. Yes, with Traxxas it's just one movement, but with the hybrid it's usually take time. Yes, now it's better. If the wire became J-shaped, then it's better. Okay. Okay, we passed the tortuous point. Killis shot next. Бери назад. Everything's okay. Just one forward. Okay. Maybe we need to change the hybrid. Единственное, слуховой слышишь? Yes, we need to turn. Yes, we need to go to that branch. Бақыт, ана жерде гибрид 8 бар, қарайсыз? No. Chikai 6. Chikai 6. Okay, let's take Chikai 8. Awesome smart mask. Yes, I especially asked for the Chikai 8 because of the little bit stiffness of the wire than the hybrid. For the navigation of the Sonic. The hybrid is a little bit softer, and now we need something stiffer. That's why I asked hybrid 8 for the distal navigation. Okay. Yes, we need to go to this branch. Yes, there is a navigation. I think it's too early to go to this branch. And there is a step. Maybe the smaller Sonic could be better in this situation. Okay. This branch also feeding. Just a second. Lidocaine, DMSO. Okay. Now Dowlet gave me lidocaine, 2% 4cc. Unik. And now we are injecting Demosul. It looks like there is a collaterals. Increase the radiation, put the roadmap and glue. Қозғалмай жата беріңіз, қозғалмаңыз. Yes, and you need to keep in mind the patient under local anesthesia. Now we start injecting the squid, which is going inside the meningioma. Intraosteal. Так да чинесо. Okay, now we're injecting inside the meningioma, in the meningeal territory. Also it goes to the some collateral. Это сквид 12. Yes, there is no reflux. All liquid embolic is going to the vascular territory. It looks like venous outflow, but it's inside the bone, inside the bony structures. Это все внутри кости. Это эмиссарная вена, скорее всего. Yes, it looks like emissary veins, nothing subcutaneous or intramuscular, and this part I think we start to feel the meningioma itself, or it could be epidural. Okay. Okay. I hope it's enough, huh? it's not detached. Даже не отделился. Okay. Okay, let's do two images, one from the extracranial. There is no circulation. It's okay, no problem. And now we will do it from the common carotid. As the next case, we are planning to do MC aneurysm. Just a second. Before the next case, I will ask David to do this looks like atrial aneurysm. Передний синтный aneurysm offset. Let's do this 3D angiography, okay? 3D жасап, КТ жасап бітіре саласың. Хорошо? Okay, let's be sure. Okay, we need to be sure. 3D Саш, пожалуйста. Maybe Hübner, maybe microaneurysm. And there is no supply from the PL collaterals. Control MR will be in couple of days, day after tomorrow. Так, тамырыңыз бітелді, қозғалмай жата беріңіз, ауырған қазір басылады. Жақсы? Қатты ауырмады ма?
Ауырды, бірақ
Все, жақсы. 3D КТ. 3D КТ. Okay, dear colleagues, now we are sure that it's artery. It's a pericallosal artery coming from the ecom territory. No aneurysm. It's better to be sure that everything is okay. And now Davlet is doing the expert CT. $100 to Davlet. Yeah. It was a Hübner. Yeah. Not Hübner, pericallosal. Yeah. Okay, the CT is ready. Now we can see from below. This is a meningioma, quite big, in the parietal and frontoparietal lobes, and day after tomorrow we will do MR control, and if the tumor will be black, then we will follow this patient. Okay, let's see. It's only one meningioma. Thank you for watching. See you in next 30 minutes. Next case is MC aneurysm. Thank you.